So the name of the podcast is the Smarter, Not Harder podcast. And we're asking everybody, what are three things that we all can do, in your estimation, your recommendation, to live smarter, not harder? It could be in your professional life, your personal life, anything in between. What do you think?
I think number one is having complete clarity of what your health is supposed to be, your financial means, your overall livelihood, your family, everything else, that overall clarity that you have. I think we forget to really have a good sit down and evaluate where we are, who we are. And so once we're able to answer those questions, the overall clarity of what you want to achieve and where you want to be, it's going to be a profound moment. Because if you don't have the overall clarity of what your perfect health is going to be, you're not going to be able to get there. And I see this a lot with clients when I first do a discovery call, where I actually ask them, if you could picture your perfect health in the next 6-month period, what would that look like for you? Unfortunately, about maybe 3 or 4 patients, sometimes in a year, may end up to say, you know what, I've been so chronically ill that I cannot even picture myself getting well.
Yeah.
Right. It's a sad scenario, but that's having a lack of clarity in terms of what their health is going to be. And so the overall work that they have to put through, they cannot do. And it's the same scenario with our finances and as well as our overall life. And so really have to picture what that overall clarity of that image is going to be in terms of your life. Secondly, in terms of making it simple, I think we're making functional medicine really complex these days. I actually said this on my lecture when I was at A4M in the beginning, is that functional medicine is becoming like the allopathic medicine at this point in time.
Yeah.
We're just randomly recommending several supplements without any thought process, right? There are tools, right? In certain cases, when you're starting out a complex scenario, you do need a lot of tools to making positive changes in the body. But as help to guide that particular client that we're seeing in a healthy scenario, do we need to give them 20 supplements, right? Is there other ways to really looking at these things? So this is a part that I really got into last year, looking at how light becomes a big major component as a nervous system, right? As long as you have those two things, looking at it in a holistic scenario, that we're able to help clients in a better ways in terms of waking up the right time, eating well at the right time, right? Having to have a sense of control their overall life in terms of their nervous system, right? And then when you are having to overall control these things, having a sound body also affects sound microbiome, because the microbiome feels everything in terms of what you're going through, right? And another thing that I also like to teach my client is about heart coherency. So that's a major component of how to regulate, but tapping into the overall intuition and the intelligence of the heart really teaches us to simplify our overall health, right? So because we're able to tap into the overall nature that we all have. So that's a part that I like to simplify and making simplify and making functional medicine easy. And then the last part is our overall our diet. I think there's too many programs and such. I think focusing on the right protein intake, which I recommend around 0.8 to 1 gram of protein per day, and focusing on
per pound,
correct. Sorry, ideal body weight. So I'm sorry, as well as adding in the right form of prebiotic, and as well as getting rid of all the toxins out. I think that should be simple enough for you to have a good diet. You don't have to spend a lot of money, right? To simplify that, instead of actually trying to focus on, is this the Mediterranean diet going to work or that? I think simplifying into just enjoying your meal, but have a guideline of really focusing on protein, healthy fat, the right amount of fiber and prebiotic. And then sometimes you want to have a cake, you could have that too.
Okay. You can have a cake and eat it too, is what you're saying. Okay. I like it. Okay. I love it.